We have a variety of lasers here in our practice, and our KTP laser that we've been speaking about in regard to the Smart Bleach system, we can also use that for a variety of other things. Now we can use it simply by attaching this different fibre optic tip, and it has a very fine little glass fibre tip there, and we can use this same laser for soft tissue treatments. So in other words, if we had to do a little bit of work on some gum tissue, or if you had a little lesion, a little lump in the mouth or something like that on the soft tissue that needed to be removed, we can do it very safely and very effectively with this same laser, obviously just at different power settings and using this different tip. And the beauty of it is that you get no bleeding. No bleeding at all. So we can do many soft tissue procedures with this, where if you had it done in the classic old-fashioned way, you might have to have some stitches, you'd have bleeding, all those sorts of nasty things. With the laser, no bleeding at all. So that's one thing that we can do. Now our other laser unit, which is tucked away in the corner here, this is what's called our Fidelis Laser, and that's what we mainly use for hard tissue laser treatments. Meaning, if we're going to restore a tooth, and we can use that very effectively for small to medium cavities in a tooth. So if you come in with a small to medium hole in your tooth, we can use the laser, that hard tissue laser, for that. So instead of having to drill the tooth, we can use that for removing the decay or for removing a part of an old filling. Now there are limits to what we can do with that. We cannot remove an old amalgam filling. We can't remove an old metal filling with that laser. But there are many things that we can do with it. One of the nice things that that laser does is that it produces a temporary anesthesia of the tooth. In other words, it numbs the tooth up temporarily. And it does that by a very clever means, whereby we shine the laser onto the tooth at a very low power setting for about 30 seconds. And without going into the technical details of it, basically what it does, it sort of shuts down the nerve fibres in the tooth temporarily for about 10 to 12 minutes. It stops them from firing off and creating the sense of pain. So once you've done that, you can then do some treatment on the tooth as though you've given an injection, even though you haven't. And so you can do sometimes some fairly significant treatment on the tooth with no injection at all. Now it's not, and I will be absolutely honest, it's not always possible to do it, to do those treatments without some anaesthetic. But small to medium cavities, and in many cases we can do those with no need for an injection and no pain on behalf of the patient.